From the N-Momentum clinical trial, participants were initially randomized to either inebilizumab or placebo, but to minimize the duration of placebo exposure, the total duration of that randomized control period was kept to 6.5 months. So any individual who experienced a clinical attack during the course of the randomized controlled period could move on to active treatment with inebilizumab and become part of the open label extension. And anybody who completed the clinical trial, that 6.5 month period, would then go on to the open label extension. The open label extension went for up to 4 years, and all individuals in the open label extension were treated with inebilizumab. What we wanted to understand was what was the therapeutic benefit of long-term exposure to inebilizumab. Now, we did see a decline in relapsing activity with each year of treatment on its own, but we also were interested to try and understand what would have happened had that placebo arm continued. And so to do that, because of ethical concerns, we couldn't do a 4-year placebo-controlled trial in a disease state where each attack is associated with potentially irreversible disability. We turned instead to use historical controls. And so we looked at a cohort of individuals who ultimately were treated with azathioprine, and we looked at their disease activity in terms of relapses before they went on to treatment. We gathered that data and in fact used that data to be the basis for the sample size calculations that set up the N-Momentum trial itself. So we made use of that data set. There are also 2 contemporaneous clinical trials, one with satralizumab and the other with eculizumab, in whom there were a group of untreated patients. And so we extracted that data as well and combined these 3 historical data sets. We then were able to ask the question, what was the therapeutic effect of inebilizumab compared to placebo? No treatment over a 4-year interval. And we found, of course, not surprisingly, that the vast majority of patients on no treatment would experience a clinical attack over 4 years. Big difference between that and inebilizumab. But as I mentioned, we also made use of a data set where azathioprine had been used, and we had long-term data on azathioprine and clinical attacks that would occur on azathioprine. And so we compared the impact of inebilizumab to azathioprine as well. Now, why is this important? Well, first off, it gives us information about long-term therapeutic outcomes with inebilizumab versus no treatment. It also gives us a benchmark over what has been standard of care therapy, albeit empirically based for many years in NMO, and gives us a sense of the superiority and added benefit of the modern medicine inebilizumab compared to azathioprine. So together, this provides us a wealth of information. And the other thing which was quite interesting is that we found that the risk of experiencing an attack actually declines with treatment with inebilizumab, such that the longer you're on treatment, the actual risk of having an attack decreases. And I think that's a profound message, because in most medications, one assumes that the impact of treatment is constant over time. But with inebilizumab here, it actually, the data suggests that inebilizumab's therapeutic benefit improves with each subsequent treatment. And that's a profound statement to make with regard to any medication.